dementia researcher with a blog and a rating.
Dementia reporting season, from inequalities to the moon. This month, 2 new reports, briefings, into the state of dementia and research have been released. We saw the first release last week by the World Health Organization. In their new fact sheet, the WHO now estimates the global number of people living with dementia to have hit 55 million. 55 million, just to repeat that and let that sink in. That is 55 million people currently living with dementia. Dementia does not only affect those living with the condition, though. Many millions more are affected by caring for someone with dementia. In fact, as outlined in their fact sheet, the vast majority of those informal or family carers are women. They provide 70% of unpaid care. This is a huge gender inequality, which is also seen in the proportion of dementia-related deaths, 65% of which are in women. Considering that 60% of people with dementia live in low and middle-income countries, where dementia care is often even patchier than in high-income countries, many people with the condition are likely facing enormous barriers to receiving the right care at the right time. In some cultures or countries, there can be a general lack of awareness or stigma associated with the condition, so that people are less likely to seek help in the first place. Even when people are not seeking help for the dementia, families can provide a great deal of care for someone. It is estimated that dementia care, paid and unpaid, health and social care included, costs $1.3 trillion globally each year. If some of those numbers make you pause for a little while and reflect, then you are not alone. Luckily, in the UK, the all-party parliamentary group on dementia has been thinking the same and launched a report this week showcasing the impact of the pandemic on dementia research, the state of dementia care and needs for future research, and importantly, making a case to the government to release the promised moonshot funding for dementia research. The report is called Fueling the Moonshot. There are a number of recommendations in the report, including targeted investment into methods for early detection of dementia and the UK Dementia Research Institute, the creation of 3 new Alzheimer Society Centres of Excellence, a specific fund for clinical and preclinical postdocs, and to support and maximise the success of joint dementia research. That's all good, but have you noticed something, fellow non-clinical dementia researchers? Whilst there is a section on care in the report, this is merged with technology. Considering that there are 920,000 people living with dementia in the UK, and many more unpaid carers, it seems inappropriate to neglect a focus on dementia care and dementia care research in those recommendations. There is no cure. Hopefully one day we will find one. But until then, we need to support those people living with the condition and those caring for or having cared for someone with it, to live well and independently. How are we supposed to achieve that when the social care system is not functioning well and still leaves room for improvement beyond April 2022? And there is not enough focus in an important report such as this by the All-Party Parliamentary Group on Dementia. I do hope that dementia care and research will receive the attention and support it deserves. And overall, both the WHO fact sheet and the APPG report paint a picture of some, not all, of these needs for dementia.
Thank you for listening. Join the dementia research bloggers and share your own views.